Health, Wellbeing and the COVID-19 Pandemic, Scottish Experiences and Priorities for the Future. Executive Summary. Introduction. This executive summary summarises the lived health and wellbeing experience of a broad range of people living in Scotland during the COVID-19 pandemic, as captured by the People at the Centre Engagement Programme, PATC. The PATC Programme of activity was led by the Health and Social Care Alliance Scotland, the Alliance, in collaboration with delivery partners including Healthcare Improvement Scotland Community Engagement, in order to rapidly capture insights from people with lived experience to help inform the Mobilisation Recovery Group's MRG work in the remobilisation of health and care services. This programme of activity was delivered in alignment and discussion with the Scottish Government-led Renew programme and the Review of Adult Social Care. Context. A system-wide Mobilisation Recovery Group (MRG) was established in June 2020 with a role and remit to generate system-wide input into decisions on resuming and supporting health and social service provision following the COVID-19 pandemic outbreak in Scotland. Contribute to strategy and policy on how Scottish Government and planning partners best approach and support health and social care reform as part of the Renew programme, and identify and harness opportunities for transformational change in primary, secondary and community care settings. A key priority of MRG was to ensure a person-centred approach to remobilisation across health services in Scotland. The Cabinet Secretary invited the Alliance as a member of MRG to lead engagement work with people in Scotland to ensure there was a wide person-centred focus from the outset of remobilisation efforts, and from the perspective of people who access support and services, that the voice of lived experience would be heard. The PATC programme was set up to deliver a series of engagement activity, managed by the Alliance, to inform short and longer term reform of the health and care support system following the COVID-19 pandemic outbreak in Scotland. The aims of the PATC programme are to hear the voices of people across Scotland about what health and care support and services should look like in a post-COVID-19 environment. Capture learning and feedback on current experiences from people and third sector partners, particularly relating to health inequalities in individuals and communities who have been disproportionately impacted by COVID-19, to inform the process of remobilising health services. Better understand the needs of populations and how services can meet public health needs in a sustainable way. Contribute to informing Scotland's prevention and early intervention agenda and public health priorities. Design and deliver an inclusive and diverse programme of engagement and communication activity, which ensures people are supported to participate and their voices are heard. Fundamentals of method and approach. To achieve the aforementioned aims, the Alliance designed a programme of engagement activity that included facilitating a national conversation on health and care in Scotland, developing an Alliance member reference group, building public health informed person-centred engagement, creating a living profile of health inequalities, challenges, experiences, and solutions. Capturing community resilience, best practice, exemplars. The engagement process was designed with an equalities and human rights approach as a founding principle, and significant work was done to involve people from a diverse range of perspectives, communities, and backgrounds. Part of this approach included ensuring that there were non-digital engagement options available. Throughout the activities, there were opportunities for people to take part using telephone, postal service, or face-to-face, in line with current physical distancing guidelines. To ensure this diversity of perspective within the programme and increase its reach, the Alliance worked with a range of partners, Appendix 3 in full report, and contributors, Appendix 4 in full report, from across the health and social care landscape, inviting them to promote the programme's own activities or to take forward their own. Across these activities, over 1,000 people in Scotland shared their views with the People at the Centre programme, resulting in a rich bank of experiential data. In developing the report findings, the programme took a thematic qualitative approach to analysing the experiences shared, identifying the common and divergent themes occurring across people's feedback, case studies, and wider published literature. This executive summary report does not attempt to reference every piece of evidence submitted, but instead summarises the themes identified from the analysis, which have been informed and supported by a significant proportion of respondents. A collection of quotes from participants in the People at the Centre programme that particularly informed the themes identified in the report are available in Appendix 5 in the full report. The narrative and emergent themes summarised within this report seek to represent the breadth of experiences shared with the programme and have formed the basis of the conclusions and recommendations reported. This report therefore offers a snapshot in time of the health and wellbeing experience of people in Scotland during the COVID-19 pandemic, and is useful for both understanding what this has been and informing the priorities for remobilisation and the future. The programme's findings chime with and are corroborated by a wealth of other pieces of research which have taken place both in Scotland and internationally, such as the 4 Harms framework. Where appropriate, these findings have been referenced within the body of the full report, and further supporting evidence is available in Appendix 6. The Alliance would like to thank all the individuals, communities and organisations who contributed to this programme of activity and shared their health and wellbeing experiences during the COVID-19 pandemic.